Hello everyone. Today we will discuss about migraine and contents under migraine. Introduction, definition, migraine triggers, stages, classification, pathophysiology, diagnosis, and goals for treatment, management, guidelines, and summary of prevention and conclusion. Brief introduction about migraine. Migraine is one of the common causes of recurrent headache. According to the International Headache Society, migraine constitutes 16% of the primary headache. Migraine afflicts 10 to 20% of the general population. In India, 15 to 20% of the people suffer from the migraine. Migraine is underdiagnosed and untreated. Definition. Migraine is a familial disorder characterized by recurrent attacks of headache, widely variable in intensity, frequency, and duration. Attacks are commonly unilateral and are usually associated with anorexia, nausea, and vomiting. There are different types of migraine triggers such as disturbed sleep pattern, hormonal changes, drugs, physical exertion, visual stimuli, auditory stimuli, and olfactory stimuli, weather changes, hunger, and psychological factors. There are different stages of migraine. Uh, there are 4 stages: prodrome, aura, headache, and postdrome. First phase, prodrome, vague premonitory symptoms that begin from the 12 to 36 hours before the aura and headache. Symptoms like yawning, excitation, depression, lethargy, and craving are boosters for various foods. Their duration around 15 to 20 minutes. Aura is a warning or a signal before onset of headache. Symptoms: flashing of light, zigzag lines, difficulty in focusing, with duration lasting about 15 to 20, 30 minutes. Headache. Headache is generally unilateral and is associated with symptoms like anorexia, nausea, vomiting, phonophobia, tinnitus, and duration lasting about 4 to 72 hours. Postdrome phase. Following the headache, patient complains of fatigue, depression, severe exhaustion, and some patients feel unusually sad. Duration few hours or up to 2 days. According to the headache classification, Committee of International Headache Society, migraine has been classified as migraine without aura, this is common migraine, and migraine with aura, classical migraine, and complicated migraine. Pathophysiology of migraine, vascular theory. In vascular theory, intracranial or extracranial blood vessels vasodilatation and intracerebral blood vessel vasoconstriction, which cause aura. And another theory, serotonin theory. Decreased serotonin levels linked to migraine and specific serotonin receptors bound in blood vessels of brain. In this images shows the release of neurotransmitters and cause arterial activation and worsening of the headache. Diagnosis, we make diagnosis on the basis of history, headache diary, migraine triggers, and investigation. In investigation, EEG, CT brain, and MRI. Different goals for treatment: establish diagnosis and educate the patient, discuss the findings, establish the reasonable expectations, involve patient in decision, encourage patient to avoid triggers, choose the best treatment, and create treatment plan. Long-term treatment: reducing the attack frequency and severity, avoiding escalation of headache medication, educating and enabling the patient to manage the disorder, and improving the patient's quality of life. Management, non-pharmacological treatment, identification of triggers, medication, relaxation of training, and psychotherapy, and another pharmacotherapy, in which abortotherapy and preventive therapy. Abortotherapy, which is non-specific treatment, drugs such as aspirin, paracetamol, ibuprofen, diclofenac, and naproxen. And specific treatment drugs, ergot alkaloids, ergotamine, hydroergotamine, and sumatriptan and rizatriptan, which are under classification of 5-HT receptor agonists. And preventive therapy with drugs like beta blockers, propranolol, calcium channel blockers, flunarizine, and verapamil, tricyclic antidepressant, amitriptyline, and SSRIs, fluoxetine. Guidelines. Migraine significantly interferes with patients' daily routine despite the acute treatment. Acute medication ineffective, intolerable, or overuse. Frequent headache, uncommon migraine condition, cost consideration, and patient preference. Summary of prevention. Use preventive medication when needed. Treat long enough. Avoid acute medication overuse. Take coexisting condition into account. Use drug with less efficacy for individual patients. Conclusion. It is more common in adults than children and in women than men. While researchers have some idea of what happens within the brain during the migraine attack, much remains to be discovered about its underlying causes and mechanisms. In addition, treatment focuses on avoiding those things that seem to trigger attacks, identifying drugs that prevent or reduce the severity of attacks, and drugs that reduce the intense pain of severe attacks. The good news is that several classes of drugs are effective for different kinds of migraine, and most migraine sufferers can work with their doctor to minimize migraine effects. There are differences.